Welcome and good morning. My name is Jennifer Nebesky and I'm the president of the Canadian Liver Foundation. We're proud to be here to mark the inaugural Canadian Viral Hepatitis Day. It's a day about educating and advocating for policies that will support the elimination of viral hepatitis, a public health threat by 2030. We are proud to be here today to mark the inaugural Canadian Viral Hepatitis Day and to call on our government to set targets and support critical policy changes to meet the commitment to the World Health Organization to eliminate viral hepatitis by 2030. Hepatitis is a disease of the liver, and viral hepatitis affects thousands of Canadians every year. It can cause short-term illness, chronic infections, and can be life-threatening. Hepatitis B and C are among Canada's most burdensome infectious diseases and affect more than 250,000 people in Canada. With me here today are my colleagues Jennifer, who is the Executive Director of Action Hepatitis Canada, a pan-Canadian coalition of 70 community-based organizations holding the government accountable to their commitment to eliminate viral hepatitis as a public health threat by 2030. Dr. Mark Swain is joining us today, and he is a liver specialist and is a professor of medicine at the University of Calgary and president-elect of the Canadian Association for the Study of Liver. Dr. Angela Crawley, to my right, is a senior scientist with the Ottawa Hospital Research Institute and an associate professor at the University of Ottawa. And finally, Mercedes Russell is an Indigenous Recovery Coach for the Indigenous Recovery Coaching Program in Lethbridge, Alberta. I'd now like to call Jennifer to the stage.
Good morning. Canada has committed to eliminating viral hepatitis as a public health threat by 2030. That's only 8 years away, but this is completely within reach. Some good progress has been made. We now have a cure for hepatitis C, and hepatitis B can be managed through effective treatments. There's also a vaccine for hepatitis B. We know how to prevent, diagnose, and treat viral hepatitis, but our policies have not kept up with the science. Some of our prevention and testing policies are not evidence-based and are certainly not oriented toward elimination. Last year, Action Hepatitis Canada published a progress report to measure how we are doing toward this goal and provide specific recommendations for each province and territory, as well as correctional facilities. We also have 5 recommendations for the federal government, which we are here in Ottawa today to highlight. Elimination planning for the jurisdictions under federal purview, evidence-based viral hepatitis screening guidelines, bringing new technologies to Canada to simplify the testing process and make it easier to start treatment, prevention through increased investments in harm reduction, and finally, collecting and sharing updated data to help us measure our progress. My colleagues are going to expand on these 5 recommendations further. Mark?
Thanks very much. It's a pleasure to be here. I think that the most important thing to recognize about hepatitis C is that it's a curable disease. Like, it's completely curable, and it's really the only chronic viral disease that we can cure. And hepatitis B is treatable and is preventable with a vaccine. But the most critical part is we need to identify the people that have these viruses. 85% of the people that are infected with hepatitis C are actually part of the extended baby boomer group, so born in 1945 to 1975. And so, up to 50% of these people don't even know that they have hepatitis C. So it's very important that we test people to try to identify the people who have hepatitis C, who don't know they have it, and then present with advanced liver disease when we really have limited options to treat them. So when we look at testing, the groups that are often left out when we look at testing are the groups that don't access healthcare the same as a number of other groups within Canada. And these are people that are stigmatized, marginalized, or from Indigenous communities. And so we need to figure out ways that we can move the testing for hepatitis C closer to those people. And the way to do that is to change the testing paradigm so that we actually can test people very quickly and then get them on therapy very quickly as well. And this is the only way we're going to really make a dent in hepatitis C in Canada. Who's speaking next?
Thank you. I'd like to reiterate and complement some of the comments made by my esteemed colleagues. On the prevention piece, I'd be remiss as an immunologist to not mention the importance of vaccination. Hepatitis B vaccination is a powerful tool to prevent infection. An important part of that strategy would include the expansion of universal hepatitis B vaccination to children at birth, rather than later in school-age children, as is the case in many parts of Canada. It is the position of the Canadian Hepatitis B Network that this approach be undertaken. Canada is also playing an important role in the discovery process of an HCV vaccine, led by recent Nobel Prize laureate Dr. Michael Hibbert in Alberta. We hope that the Canadian government can be fully supportive of this process as it carries out its clinical trials and hopefully eventually manufacturing, so that these can happen on Canadian soil. To measure our progress in viral hepatitis elimination, we need good data, as my colleagues have mentioned, about how many people have it. This has been a major problem for decades. Estimates and modeling repeatedly suggest that a small fraction of infections have been diagnosed and an even smaller fraction undergo treatment. We're asking the federal government to help fund and increase efforts to collect updated hepatitis B and C prevalence estimates for all Canadian provinces and territories. It should be stated that the collection of these data be done in a responsible and appropriate partnership with Indigenous peoples, respecting OCAP principles of ownership, control, access, and possession. Lastly, I want to emphasize that there are serious implications on people's lives when we get these things wrong, and so many people live with a silently progressing viral hepatitis infection. For example, in the United States, predictive models indicate that 50% of individuals with hepatitis C virus will have developed serious scarring of the liver known as cirrhosis by 2030. This situation will be further exacerbated alongside increasing evidence of metabolic liver disease, resulting in more people with both hepatitis B and hepatitis C and a fatty liver condition. So living with hepatic viral infection scars not only the liver, and poorly advanced liver disease, but we also believe that this impacts the immune system in long term, having an impact on our response to reinfection, ongoing poor, inefficient responses to vaccination, and threatens the likelihood of success in applying these vaccines to these vulnerable groups. We know that this experience puts many at elevated risk of liver cancer as well, the highest of all risks in those of any kind of chronic liver disease. Thank you for your attention on these issues.
We're ready for questions? Yes. Or is there one speaker left? Oh, perfect.
Mercedes, would you like to share your story with us? Sure.
Yeah. Hi, my name is Mercedes Russell. I am a recovering addict. I'm from Lethbridge, Alberta, and I'm from the Blood Tribe Reserve in Standoff, Alberta. I started using drugs when I was 17 years old. I'm 29 now, and I've been sober for 4 years. 4 years ago, I was diagnosed with hepatitis C from drug use. It wasn't until 4 years ago when I, found out that I contracted the hepatitis C virus from drug use. So I didn't even know how long previously I had hepatitis C before that. Luckily, I was able to get it taken care of at an early stage. And through my experience, I'm just really pleased and honored to be here with this wonderful group to kind of tackle this problem further. So it's groups such as the addictions group and then other people like the baby boomers to really tackle this, this virus so there can be more survival stories like myself. That's what I'd like to say. Thank you.
Thank you, Mercedes. Well, thank you all. If we will take questions now, if anyone has any questions.
Fraser, do you have?
It's a stampede to the mic. It's Fraser from AP10 National News. I noticed that actually in your press release and that you say there's hepatitis C and B tends to affect disproportionately marginalized communities. Could you maybe explain a little bit why that is?
Jennifer, do you want to, or Mark?
I can start, and then probably Mark will have some more to add. We've, through some work with the with the Canadian Network on Hepatitis C through a Blueprint, they've identified 6 different priority populations that are disproportionately affected. One is Indigenous people, one is people who have been incarcerated, people who inject drugs, some newcomers from countries where hepatitis C is very common, boomers, older adults, and then also an emerging priority population is GBMSM, so men who have sex with men. And specifically, the populations who are holding the most burden are populations that overlap a lot. So unfortunately, people who are incarcerated overlap a lot with people who inject drugs, and also overlap a lot with Indigenous communities. So where those priority populations overlap, we see an even more increased burden. Partly due to the way that hepatitis C is spread. The most common way hepatitis C is spread is through shared needles, and then also the difficulty to access medical treatment. People often don't have access in some of those communities. They're more marginalized for mainstream medical care. Mark, do you have anything to add?
Just a little tiny.
Sure, thank you.
Yeah, thanks very much. So I think another way of even looking at it is that hepatitis C is overrepresented currently in the priority populations, in part because of the issues with accessing care, and so really, when you look at hepatitis C as a global phenomenon, you look at a lot of baby boomers who are very familiar with the healthcare system and can access care. We have a curative therapy. We can cure them, and so they access care and they're cured. Whereas many members of the priority population, so the Indigenous communities, people who use drugs or have used drugs in the past, and a number of the other groups that Jennifer mentioned, they don't or they can't access care. And so because they can't and they don't, they are not tested. And because they're not tested, they don't start the pathway towards care. And because of a lot of the issues around stigma that are associated with hepatitis C, they actually, once they start down that path, they're often lost along the path. So they actually don't get to the end and get cured for hepatitis C, which is of course a tragedy when they present later with a liver failure and cirrhosis when it's a disease that's completely curable. We just need to rethink how we approach those populations so we make accessing care something that's easy for them, and so we can get them into a situation where they're being tested in a non-judgmental way, and then they're being offered therapy that's very quickly done, and when they're ready to be treated, the treatment's ready to be given, and then they can realize the benefits of a curative therapy.
Yeah, I got more questions. So just in terms of, and changes in testing, could you maybe be a bit more specific as to what you would like to see in terms of changes across the country in testing to make it not only more accessible, but so it becomes more commonplace, I guess, for people to get it done? Yes,
thank you very much for that question. So the issue now, of course, is that this testing is multiple steps. So people come to the doctor, they'll get referred often to a specialist. They have to go see the specialist. They have to find time. They go to see the specialist. The specialist then gives them a form so they can go get blood work done. They go get the blood work done. They come back to review the blood work. They might need extra blood work, so they go for more blood work. And you can see that there's just way too many steps of testing along the way. And so to get around that, one thing that's come to Canada is being more widely used is a point-of-care test to look for the antibody. And so that can be done to at least show that someone has been exposed to hepatitis C, but some of those people may have cleared the virus on their own. So then you have to look for the virus itself in the blood, but there's also tests you can do with a finger prick that can also look for the virus itself. And one of them is called dry blood spot testing, which is becoming more available across Canada. And the National Laboratory in Winnipeg has been a real leader in that area. And then there's another test that's not available in Canada, which is an antigen test. It's like we're all very familiar with COVID, and we're all very familiar with going to get testing. And we used to have to go get the swabs, and then do the PCR test, and we did wait 48 hours. Now everyone has the antigen test. You just do you just do the swab at home, and then you test it, and you know very quickly if you have COVID. And so there's tests like that available for hepatitis C, but they're not approved in Canada. And so if we could accelerate the approval, I mean, they're used in Australia, then you could actually diagnose people who are infected, just like we decide about whether or not we should go to work because our COVID test is negative or positive. We could do it the exact same way with hepatitis C, which would then allow us to treat the people who want to be treated very quickly. Same as COVID. If someone tests positive and they're starting to be symptomatic, we have pills now to keep them out of the hospital, right?
Yeah, so I guess that's the case. We just came through the COVID pandemic, and I guess as you've seen, governments have moved mountains to make vaccines available, testing, things like this. Hepatitis C and B have been around for a while, and there doesn't seem to be any provincial coordination or a national kind of plan. So it's not something we see here talked about from federal officials for sure. Why do you think that is?
I don't want to monopolize. I'm happy to answer it, but I don't want to monopolize the.
Maybe Jennifer. I can if you like.
Yeah.
You okay? Yep. Thank you. Oh yes, sorry, I did forget that last time. Thank you for the question. Certainly, part of the point of Viral Hepatitis Elimination Day is to increase urgency, a sense of urgency. We do see a lack of urgency and a lack of political will around hepatitis C and B, and it may be because it's chronic. It has a reputation of being a slow killer, so it's hard to maybe to build urgency around that, and also because it largely affects marginalized people, that may also be part of the reason there isn't a lot of political will and urgency. But we're hoping to draw attention by bringing stories like Mercedes and bringing stories like hers and others today. And we have a parliamentary reception this afternoon where other people will be sharing their stories as well. So we're trying to increase urgency and political will. That is the goal of the day, for sure.
And it sounds like you would like to see a much more aggressive immunization policy as well, or practice.
Yes. So as was mentioned, there is a vaccine for hepatitis B. World Health Organization does recommend that it be given at birth. However, in Canada, some provinces do it at birth, some do it at 2 months, and some do it at 11 or 12 years. So there's no standardized approach across the country, and it leaves a window where kids are very vulnerable to developing hepatitis B. And at the time in their lives when you are an infant or a child, it has a 90% chance of becoming chronic. So if you are an adult, that chance is lower. It's more like 20% that if you have hepatitis B, it'll stay with you forever. But as a child, if you get it, you could be living with it and having to deal with it for your whole life. Did I get that right, Angela?
Yeah.
Yeah. Thank you.
And it sounds like the drugs have moved very rapidly, more rapidly than I covered an event on this few years ago. And I wasn't aware that actually, is it hepatitis C now that's curable?
Yes.
That's right. I certainly didn't know that. Do you think part of the problem is a lot of people sort of, they can live with this disease, but it's kind of a fatalistic that they don't go get tested, or maybe because they're not aware of how fast the drugs have moved on this?
I think that's some of it. Do you want to take that one, Angela? Sure. Thank you.
Yeah, I mean, to kind of related to your last question too is, we need to kind of raise the roof a little more on these two viral infections. We, far outweigh in numbers the number of people infected globally than HIV, for example. but that cause was accelerated very, very effectively. And so if we look at the history of raising the roof and funding and, you know, collaboration in the research field and pharmaceutically for HIV, it was tremendous. In hepatitis C and hepatitis B, at least, you know, I'm a little bit younger, I didn't see that. And we're maybe being too gentle. So I think government's not supporting it perhaps is speaking to that. They don't fully appreciate that there is a cure, and that in the back room there are also antiviral drugs that mimic the action of hepatitis C. They're being tested for hepatitis B. So it could be just around the corner. It could revolutionize that whole landscape. But there's a lot of media or something to catch the ear of the government so that they can support these initiatives, that they can support when the vaccine for hepatitis C is finally reaching a point to be tested and manufactured, that Canada is at the table and the leader in that. So we need to be more creative to raise the roof. Thanks.
I'd like to.
Well, this concludes. Oh, you have an answer? Go ahead.
I just want to build a little bit on that because, I mean, when you watch the news, you will see a lot about COVID. We see a lot about the opioid epidemic and all the issues related to both of those, but they intertwine directly with the same populations that are affected by hepatitis C, and it's very interesting that when you have a disease like hepatitis C and hepatitis B, but let's say hepatitis C, that's a curable disease. And we know that when people are engaged in care, they're tested and they're treated, not only does it improve their liver-related mortality, it actually improves their overall mortality. So they're less likely, if they're using drugs and they're still actively using drugs, they're less likely to continue and they're less likely to die of drugs. So, and then when people are engaged in care, if people focus on, say, COVID in an Indigenous community or reserve, if you focus on COVID or you focus on the opioid epidemic, you actually ignore the fact that underneath that is hepatitis C. And if you engage people in hepatitis C care, you can actually make huge inroads with regards to to overall wellness. And so it needs to be incorporated into that thinking that actually treating viral hepatitis is a way of engaging people in care in a way that's holistically beneficial to their health.
Okay, thank you.
Yeah.
This concludes the press conference. Thank you.
Thanks.